We study how the heart forms early in the embryo because we're really focused on trying to address a disease called congenital heart defects. And congenital heart defects are issues that are present early in development and at birth, and they occur when a baby's heart doesn't develop the way it should. So this is a little bit different than cardiac arrest or a disease like cardiomyopathy, where there's sort of maybe normal heart function at birth, but over time, as you age, the heart stops working. This is a problem that is present at birth and sort of needs addressing right away. Just some numbers to sort of contextualize how many people are affected and what this really means. So 40,000 babies are born with a congenital heart defect each year, and that's about 1 in 100 live births. And that's a bit of an underestimate of the real problem because some of these babies, unfortunately, don't even make it to term. 25% of these patients, of these babies, will need surgery within the first year of their life in order to survive. The good news is that the survival rate has increased pretty tremendously since sort of the late 80s, early 90s, due to advances in surgical techniques. So the surgeries to correct some of these congenital heart defects have really advanced. But unfortunately, our ability to truly prevent and stop these defects in their tracks hasn't really occurred. And although the survival rate is much higher, there's still a huge burden due to the result from congenital heart defects. So even though these patients have their hearts fixed, they're at risk for problems later in life, such as issues with their valves. And so this leads to a large economic burden of up to $74 billion annually. And so that's not just sort of correcting the early defect, but also all the sort of long-term challenges that are downstream of the initial defect.